Once we have the animal in the squeeze chute, might want to consider restraint, particularly for those animals that are a little intractable, for both the protection of the individual as well as the collector. Next, we'll put on a pair of disposable latex gloves. The reason we put on gloves for every bull we test is to reduce the possibility of cross-contamination between bulls, particularly when PCR testing is involved. Now we're going to get our scissors and a paper towel in order that we can trim the sheath hair from the sheath. And we'll dry the sheath if there's any excess moisture accumulation with a paper towel. After we complete the process, and then wipe any excess hair from the scissors, from any excess hair or moisture before you place them back in a disinfectant. For those bulls with a dirt or debris in the prepuce, a minimum amount of saline is to be used to lavage the sheath. Now we'll prepare for sample collection from the bull using a new 12 cc syringe to produce a vacuum on our guarded pipette that will reduce any contamination as we go into the sheath. And now we're prepared to collect our sample, introducing our pipette into the sheath. Remembering as we get close to our area of the fornix of the penis, we won't extend our pipette through our guard sheath. Being aggressive in our sample collection, applying steady vacuum on the end of our pipette. We'll collect our sample, being aggressive but not trying to get so aggressive we get blood contamination, and then we reduce our vacuum as we withdraw our pipette from the sheath. As you can see, we have an excellent sample. As we prepare to inoculate our sample, we want to make sure that the bull's identification is properly recorded on the in-pouch culture media. We'll introduce the pipette into the upper compartment of the in-pouch, aspirating a couple or 3 times to completely inoculate the smegma sample into the pouch as manufacturer directs. Then we'll make 3 to 4 turns of the top of the pouch to express the fluid into the lower compartment. We'll seal the pouch by turning the little yellow tabs on in and placing in our container in an upright position. We're fixing to put our smegma sample in phosphate buffered saline. We have 1.5 mils. That's 1.5 mils of saline in our tube. And we're going to aspirate some content into our smegma sample, making sure we wash our pipe out good. And now we have our sample in the tube ready for submission to the diagnostic lab.